the duck virus enteritis. Duck virus enteritis or duck plague. Duck virus enteritis is an acute herpes virus disease of duck, geese, and swans characterized by weakness, thirst, diarrhea, short duration, high mortality, and by lesions of vascular, digestive, and lymphoid symptoms. Parents, wild and domestic ducks, geese, and swans are affected. The disease was first observed in Netherlands in 1923. Initially, it has mistaken for avian influenza, but in 1942 it was clearly differentiated from avian influenza and was termed duck plague. The etiology agent is herpes virus. The virus is non-heme-agglutinating. This differs from the virus causing Newcastle disease virus, avian influenza, which do heme-agglutinate. The virus grows best on the chorioamnion membrane of 9 to 14 days old embryonated duck eggs or on duck embryo fibroblast. Initially, it doesn't grow in chicken egg flow, although it can be adapted to them. The virus also can be isolated in duckling, with Muscovy duckling being the most sensitive. Clinical signs in young commercial duckling. Signs appear 3 to 7 days after exposure. Duckling have diarrhea, a blood-stained vent, dehydration, and cyanotic bill. Death usually occur in 1 to 5 days. In domestic breeder ducks, there is a marked drop in egg production, 25 to 40%, a sudden high persistence mortality. Sick birds show inhabitants weakness, ataxia, photophobia, adherent eyelids, nasal discharge, extreme thirst, prolapse of the penis, and watery diarrhea. Morbidity and mortality are usually high, but vary from 5 to 100%. Most birds that develop clinical signs dies. Lesions. Hemorrhages are present at many sites, and there may be free blood in body cavity, gizzard, and intestine. There is severe enteritis. There may be elevated crust plaque in the esophagus, ceca, rectum, cloaca, and burst of secretions. There is hemorrhages and necrosis in the annular band or disc of lymphoid tissue along the intestine and in the spleen. The liver may be discolored and contain petechial hemorrhages. Typical signs and lesions along with episodic losses are highly suggestive of duck plague. The virus should be isolated and identified for confirmation. The virus will grow initially in embryonated duck eggs, and increasing antibody threat to duck plague virus. Duck virus enteritis must be differentiated from duck viral hepatitis, pasteurellosis, Newcastle disease virus, avian influenza, coccidiosis. Both killed and live attenuated vaccines are available for prevention.